Hi, Evie. Thank you for being on our episode of The Cocoon. How are you doing?
Hi, thanks for having me. I'm doing pretty good. How are you?
I'm doing good. The heat here is just incredible right now with how hot it is. But yeah, so you're in Queensland. What's the weather like for you up there?
It's disgusting. It's hot, it's sticky, it's North Queensland, but we love it up here, so we
That's
deal
all.
with it.
Yeah. North Queensland is pretty good. I'll admit that. So, what do you do?
I am an advocate for domestic and family violence and sexual violence, and I'm also a domestic and family violence specialist as my day job. So,
That's
yeah.
awesome. So, what inspired you to become an advocate for DV and SA?
My whole life, I suppose. So when I was very young, as early as I can remember, I was growing up in a DV household, witnessing domestic violence frequently. And that transpired through the rest of my life, I suppose. So, I left Brisbane, which is where my father is, when I was 8. So that's when we first fled the domestic family violence. And we came to Townsville. And I think most people assumed that when we came here, the DV stopped, but it didn't. It transpired through my whole life, until I was about 17. I was like, dude, I've had enough. Like, it's it. I'm calling it quits. Like, leave me alone. I'd love to say that's where it ended, but it still did. Like, they don't listen, so it didn't end there. But it has ceased with him now. But in amongst that, I've had my own DV relationships. My mum has had other violent relationships as well within that. So it has just been pretty much a major part of my life. Um, and then I have been sexually assaulted on numerous occasions. And through that, I found my voice through the Women's Centre here in Townsville. They have specialist counselors for sexual violence, and they have a lot of opportunities to be able to platform your voice. And I was quite lucky in the sense that I was able to speak safely and freely. And that has transformed my life into being an advocate. And here I am. So that's my story.
Oh, wow. Well, I mean, thank you so much for sharing all of that. It does sound like you've been through a lot, and I think just your journey of being an advocate as well, because you are still at, like, such a young age, I think is so amazing and so inspirational. So prior to us talking about here, you mentioned about how one of your concerns, particularly in Queensland, is the lack of counselling and I guess quick services. Would you be able to go more into detail about that?
Yeah, so it's a major problem, I think, not only in Queensland, but across the country. Having access to services, they've put they put the cart before the horse in a sense of we have been very focused, or the government has been very focused on educating people around consent, what domestic and family violence looks like, those sorts of topics, but then forgot to fund the front line. So services are still operating at a level that they were operating before all of this education has come out, which has also increased reporting, which has increased people needing to access these supports without any major increase in funding, which has now led to long-term wait lists, and it's seemingly endless for a lot of people. With us in Townsville, and I know it exists in other parts of the state, is the sexual assault response team. So people who go up to the hospital, social workers, to talk to sexual violence victims, and they offer that, quick short-term counseling while they're there. The process is they're meant to be that is linked in for longer term or short term, medium counseling. But when we're looking at the numbers on the wait list, you can like see that that's not what's happening. So in the realms of sexual violence and domestic violence, it's all kind of in the same boat to access counseling here. We don't have many other alternate services. And it is, yeah, just a very long wait list.
Yeah, I completely agree. And I'm like, and you're right that that's also a really big issue here in Sydney as well, because I think, Australia is currently in like a mental health epidemic right now. And, some not for profit are also saying we're in a domestic violence epidemic as well. And so do you think that also this is, I guess, a lot more worse and severe in rural areas? I'm assuming so, particularly in northern Queensland.
Yeah, rural and regional areas have very limited choice when it comes to counseling and free accessible counseling, um, and specialist counseling as well. So in Townsville, we only specialist wise for sexual violence, like you go to the women's center. You don't go anywhere else. So that's the ideal. We have probably one other service, which is NEMI Women and Health sort of counseling service. But again, they're not like high level sexual violence, domestic violence service. You go to the women's center. So that's your only choice, really. And then if you take it even more regionally and rurally into small Indigenous communities in the northern end of Queensland, you're expecting victims to go into services more often than not where their family members work. So that idea of confidentiality is just thrown out the window. So a lot of people won't access those supports. There's not enough safe and accessible supports in rural and regional areas. And it's not spoken about enough because it's the big cities that get the media attention.
Yeah, definitely. And I definitely think that those are really important issues that you've brought up that I think correlate and are responsive to, definitely nationwide with Australia as well. Sydney is the same. I'm pretty like Perth in Victoria regions as well as the same. So, as an advocate and also like a worker yourself, how do you think that manifests in the pressure and issues of trying to provide these services to people when there's already long waiting lists?
I think that from like the victim's point of view, or from, do you mean from the victim or from us as sector workers?
If you're able to do both, that'd be great. But I
Okay.
mean, if you could focus on like the worker's perspective, that'd be great too.
Okay, cool. So from the worker's perspective, the pressure it places on me, now I can't speak for every person in the sector, but I will speak for myself, is that I am completely aware of how many women, probably actually not completely, but fairly aware of how many women are experiencing domestic and family violence. And in regional Queensland and regional parts of Australia as a whole, we experience domestic and family violence at an unprecedented rate, in comparison to other cities. So we sit here having to decline referrals or listen to stories about people being turned away or not being able to access supports. And then I sit in a very awkward space where I'm also engaged as an advocate, having to know all the statistics and knowing then the rate of re-victimization or going on to perpetrate violence when not being able to access that help. It's this constant cycle that's going to secure funding, but it's not going to secure that 10-year plan.
Mm. Yeah, definitely. And you're right. Like this ability of only providing short and medium term counseling, I think for majority of cases of domestic violence and sexual assault is just simply not feasible. So I remember with our conversation, and you specifically advocated for the lack of counseling for children and teenagers as well in these situations, and that there needs to be more counseling services provided for them. Are you able to go into a little bit of detail about that?
Absolutely. I think everyone knows children are victims in their own right and they are deserving of counseling and support. I don't think it's a knowledge problem, it's an accountability problem. Because if we start to put on display just how many children are victims of domestic and family violence, and we were to offer them all counseling, then cost of that would blow our budget through the roof. So it's very hush hush. People don't want to speak about the impact that this has on children. But I think it's time that we do start speaking about it, because as we see through reports through ANROs, who have just done the In Their Own Right report, and also the report that they had on mortality when it came to people dying in domestic and family violence and re-victimization and things like that, it was very clear that children who don't access help are likely to become a victim again and continue on, similar to my story, or are likely to perpetrate violence later down the track. So this is why we need to start supporting children, because the whole Stop It From the Start campaign really means nothing if we're not going to support the children who are at the start.
Yeah, exactly. And you're right. Like, and I think also it's just such a really, it's a like it's it's definitely like it should be mandatory, but I guess it is a tricky situation, regarding legally how a lot of these children, need like guardianship consent or consent from parents to even like even practice and receive these types of counseling. But then how does that work when majority of the time the
Yeah.
perpetrators are parents in the first place?
I
So
think it comes
yeah,
down to really, I think it comes down to like you know, offer over and above support on times to women to offer that level of counseling and support. And these are all your options available to you. Having that conversation in a room with parents and children, and then if they're declining that support for the child, that's going to raise red flags immediately. That's another avenue for support for the child. If you're seeing those red flags, you're able to report those red flags. You're able to watch those red flags, report it back to the schools. Like there's so many other pathways to go down, but it starts with firstly offering the support. But you have to have the support to offer the support. And currently we don't have it. In Townsville, we have, I think, very few programs, but only one program with their books open, but you won't be seen till next year.
yeah, exactly. And, and again, these types of situations require really immediate urgency and action. It's not something that can be fixed in the long term, can it?
No, you can't just decide that they'll be seen in 4 months or at like a minimum and then be like, oh, we'll talk about it then. Like you've missed a crucial part of helping that child and the impact on the brain, which we could talk about forever, but I'm not going to delve into that. But it has such a huge impact on that child for the rest of their life. Why wait until a child is fully grown at 20 for them to access counseling supports because they've just been a victim again? That seems
Yeah.
silly.
Yeah, you're right. It does. There needs to be, you're right, that very urgent kind of reactionary type of counseling that's provided while that child is experiencing those moments. So just from your experience as being like a victim and I guess seeing your experience, I guess, of working with other children, what would great support and counseling look like for you for a child?
I suppose that's a good question. Actually, I haven't been asked that before. I think I honestly just wanted someone to ask me more than if I was okay. Because I had that question twice. Someone said, "Are you okay?" And I'm like, well, "Why wouldn't I be?" I didn't know that what I was going through wasn't normal. So I think if I was to have counseling, it would have been nice to have a rapport building, have a safe person who I can talk to, who has those specialist skills in asking more than, "Are you okay?" Because I was, air quotes around this, fine, because I didn't know that it wasn't okay. I didn't know that I wasn't meant to feel scared and I was meant to feel safe and secure. I didn't know that. So it's about having someone who I can build rapport and trust with as a child to then be able to disclose to them about anything that's happening. But it takes more than, "Are you okay?"
Yeah, definitely. And I really think that aspect of you mentioning rapport and trust is so important. I think particularly because with a lot of these like free affordable types of counseling, you're kind of like continuously seeing different counselors instead of that one counselor. And as someone who has been through kind of similar situations, you're just tired of having to explain the whole situation over and over again to different people,
Yes.
being afraid of those different types of judgment. So you're right, like as a kid or as a teenager, it's just kind of easier sometimes to say, yeah, everything's fine, because you don't want to have to explain everything all over again and go through that re-traumatizing again.
Exactly. And I feel like even now as an adult, like I can still speak to this. I was seeing a counselor at the Women's Centre for near on 3 years and then she resigned. I'm like, oh great. Now where do I go? And so I've linked in with a new psychologist, but I get like 12 sessions and then it's like maybe you'll get more for free, maybe you won't.
Mm,
But by that 12, like I think I'm almost halfway through and I still feel like I haven't built that rapport yet because I've
mm,
just lost 3 years of rapport building with somebody else. And I think
yeah.
that we all feel that way and children aren't isolated in that emotion or that expectation that you want to have rapport with the person that you're about to pour all your trauma into. We want to trust those people. We don't just tell strangers as adults. Why should we expect kids to?
Yeah, exactly, and I completely agree with that as well, and I think it's just a really tricky situation, and I don't know, like, what strategies can be put in place to kind of get over that hurdle. I don't know if that's like, what recommendations do you think as an advocate do you think would be better to help these children establish this rapport with these counselors?
I think it's fairly simple. Fund the front lines. Like pour more funding into supporting the people who are already doing the work, and then so we can grow that that network of people as well. You have people who want to do this work, but you're not like funding it properly. So that means we can't have more staff to for the high demand of children and other victim survivors to access supports. I think
Mm,
the answer to it's very simple, but I think again, it's not a knowledge problem, it's an accountability problem.
mm. Yeah, you're right, and you're right, and I just think that there's not enough staff and workers available to deal with just the ever-growing problem that is happening in Australia of domestic violence and sexual assault, and how it's now considered an epidemic in a lot of cases.
Yeah, definitely not enough qualified staff. However, I think that's where we can then reflect on the importance of a piece of paper. Is it
Mm,
important? Personally, I don't have a bachelor's degree. I intend on getting the piece of paper so I can tick a few boxes, but I know I can do my job well. Otherwise, I wouldn't be sitting in front of you today. And I didn't need a piece of paper to do that. I'm able to hold space. I have lived experience. I've, much further along in my healing journey. I'm not still in the midst of crisis. I have the knowledge of what like some people need to hear. I'm not perfect. No one's
mm.
perfect. No one even with a piece of paper is perfect. But that idea of peer support, lived experience coming into this space, making room for it. Because at the end of the day, if you've never experienced sexual assault or domestic violence, nothing you read in a book's going to help you understand it. You can understand the baseline structure of how a violent relationship may look, but until you've been in one, you don't really know. So being what support you actually need during that time, what you need to hear, you don't know because you've not been through it and you're going to just be doing some guesswork when you first start. So I think it's really important to consider that there's a lot of people who would love to do peer support in this space who can't access uni to go on to do social work because again, uni is a privilege. It's not accessible for a lot of people to do. So we have people with the skills, just not people with the paper.
Yeah, particularly in, like you mentioned, regional and rural areas where university are hard to access, even if you do it online. Like I'm assuming North Queensland probably wouldn't have maybe the best 4G, 5G networking.
No, it's not great. I've got 5G, but nothing loads.
Mm,
And then yeah, so you've got like
mm,
you've got that accessibility problem of being able to access online learning.
mm,
And then even like our local major, in air quotes, major university is shutting down programs left, right, and center.
mm,
And then that's James Cook University, and then we have Central Queensland Uni, who I actually don't know anyone who goes there and learns on site, maybe except a few nursing students and paramedic students, but everything else is online. So that's also not a super accessible way to learn for a lot of people. People need that face-to-face interaction. COVID destroyed that for,
yeah.
you know, for us up here in regional North Queensland. It's like, oh, great, we'll just chuck them all online. They'll learn. I never learnt online. So it's not accessible for me and it's not accessible for a lot of other people. And also finding the time financially, there's so many barriers to accessing education when there's already people with the skills.
Yeah. So, so what in your mind would be the best way to help provide education for these qualified, like for these workers to become more qualified that isn't exactly like university based?
On the job training.
Yeah.
I
Like
think it's
prac?
super important. Pardon?
Like prac?
Yeah, like prac, but paid.
Yeah.
If you can, in my instance, it was like I didn't have a single formal qualification behind me when I joined this sector. Did I get out into my community and advocate? Yeah. Did I build connections and network in this sector so I could learn about the sector? Yes. And then I got a job at our local community, one of the local community legal centers, and continued to network, learnt about domestic violence. I asked questions. And then when the job I have now came up, I was able to back myself in with the knowledge that I had learnt on the job. And that whilst I may not know all the components of the legislation and everything that's outlined on paper, I could learn that and put that into practice. So I think part of it is just really that work life experience and knowing how to ask the right questions and get into the right rooms and sit at the right tables. that does come into it in my case. But if I was to think about just qualification wise, that would be more accessible. I think having courses through TAFE for social work, if you still wanted people to have that piece of paper, I think some form of qualification that's similar to social work, that's not at the same level as a bachelor, would be more accessible considering it's now free. And then it ticks the box of having the piece of paper and that they can still work while they're doing TAFE. And I think that it's really important to, have students working while they're learning, because you can finish uni with your piece of paper and have no idea how to do your job. So
Yeah, I think
yeah.
that's a really I think that's a really good outcome, and I think a very feasible and realistic plan of how that could work. So I think also like a really big reason, as as someone who volunteers as well for like the not-for-profit, is I see a lot of like support workers and workers in this type of industry who experience so much compassion fatigue and burnout. How do you, like, as a worker yourself, how do you, I guess, prevent that or take care of yourself when there is just such an overload and constant need for help?
um Good question. I think it's something I struggle with, and it gets pointed out a lot. We had a student the other day that came in and said everyone does great with their self-care except me. So I don't think I'm the most qualified to answer that. But I feel like it is, maybe I will regret saying this, and I feel like everyone has probably said it. For me, I find a lot of solace in, like, obviously my 9 to 5 is extremely exhausting. I love what I do, but it requires a lot of emotional strength.
Mm,
But for me, I feel like I've put that frustration of, and like exhaustion, which is a weird word to use for what I'm about to say next, into my advocacy outside of that. So, talking about workers' rights in this sector, talking about my rights as a victim, as a child and as an adult, and because I'm seeing the bad every single day of my life, and then I have, time after work where I can put that into seeing good and seeing change happen and working with other victim survivors. So for me, I counter out my day with a different way of doing my job that seemingly is more positive for me. So it kind of counteracts, but there are definitely still days that both become a a big ball of stress. So it's hard, I think, to manage it. And I could say go for a walk, go for a swim, read a book, but we all know that that's just not how the world works. So I think it's about just talking it out is sometimes the best way to do it. I know for me, I've written things and chucked them in my fire pit, and just whatever kind of works for you. I don't think anyone has the answer to how to manage burnout and stress. It's an 80% burnout rate in this sector. If we had the answer to it, 80% of us wouldn't be burning out.
yeah, exactly, and I think you're right, like, it's just more so about taking those small moments to yourself every day as much as you can, like, rather than trying, I guess, to cram it all and then hope for a weekend or something where you can de-stress. Unfortunately, it's a lot more realistic to just try and take 5 minutes out of your day in these type of jobs rather than hope that you've got a really good weekend to yourself.
Literally. Or like for me, like I do weird things. I lay on the floor at work a lot. And they're like, what are you doing? I'm like grounding, I guess. I don't know. Just being like, if you sit at your desk all day, day in and day out, and that's just how you are when you go to work, that also puts stress on your body. Change it up. Sit outside. I love sitting at the back table at work. I just make little changes here and there, so it's a little bit different every day. And laying on the floor sometimes is the best I can do. Tears hit the carpet, soaks it up. It's all right. We trot on. And I know that's not healthy either. And I don't think, whilst I do appreciate that we are, a lot of people view that we're underpaid in this sector, I don't think throwing any more money at us is also going to combat burnout either. We at my work, which I think I'm allowed to say this because you're allowed to talk about your pay these days. Um, I get a $50 a fortnight wellness payment. And I was like, cool. Or hear me out. We could have free face-to-face employee assistance programs instead of over the phone. So I think it's also investing in well-being for the staff. rather than expecting staff to access their own supports or just deal with it. Because I know for a lot of us in this sector, it's a matter of if you have emotions, can you do your job?
Mm.
It's a question that's asked a lot, and I'm very emotional, which it's pointed out to me quite a bit. Like for example, I had a matter this week, and I kind of just shut down. I was like, oh God, that was a lot to hear. And I just needed to take the day. I was like, I need to go home. Like, I'm not probably in the best headspace to be supporting anyone else at the moment. I need to support myself. So acknowledging that's really important. And then my boss said to me, what does this mean for you for the future of your employment if like you shut down over that? I'm like, girl, I had one day. Like it was one experience. And so being able to advocate for yourself is super important too. Advocate for yourself the same way you'd advocate for your clients when it comes to well-being.
Yeah, I think like what you've all said is just really relatable. And I think so important as someone who also, kind of works as kind of volunteers in this kind of industry, where your emotional regulation and health is so important in order for you to provide and be emotionally available to the people that you seek. Because I don't think like there's anything worse when you're trying to access help and you can tell that the person that is meant to help you is just as tired and as burnt out as you. It's like you can't
Yes,
really feel you can,
it's so
express
funny.
yourself.
Yes, it's hilarious, and particularly at the counseling where I did counseling to begin with. I've already said it at the women's center. I could see the burnout in my caseworker. That is not her fault. And that's not the service's fault either. It's the industry that we work in. And we all talk about burnout and stress, and then I go to see a psychologist. I'm like, this girl feels the same way I do right now. Like, and it is exhausting to try and access that support. But I think that peer support, like within your workplace, and then also like, how your psych feels, cool, talk about it. Like they will talk to you about burnout and stress and their own personal beliefs and strategies around it. And I think it's important we acknowledge that we're all pretty stressed in this space and
Yeah.
we just chat it out with each other, because otherwise we're all pretending that we're fine, which is not the point.
Yeah, exactly. I think that shared sense of empathy is so important. Plus, I think there's also that like great sense of camaraderie of just, we're all in this situation together. We're all feeling it. We don't have to like really express or heavily express our feelings because we all kind of have that similar sense of we're here, we're tired, we're exhausted, but we love what we do and we're going to keep doing it.
Yeah, exactly. Like even today I left work earlier than my other colleagues that had started earlier. And on my way out the door someone said, just try not to think about work tonight. Don't think about the building. Just go home and try to relax because it's been a stressful day. And I'm like, I'll do my best. Thank you. And then they're like, oh, and just walk out. But we all know, like we all know we have off days. And like for me, my saying at the moment to everyone, including some of my clients, because I think it's important to note that victim survivors are very socially aware. It's not like they're not aware of the world around them. So not something I've been saying to not only the women I work with, but the staff is the world may be on fire. Yeah. But you know what? We only have one host. So it is what it is. We have to live in this burning world and we have to just accept it for what it is some days, because I would love to sit here and say we're going to end domestic and family violence in the next generation, but I don't even believe that would happen in my lifetime. This has been ongoing since the beginning of time. It's unfortunately it's not going to end. We just have to learn how to cope with it if we're going to work in these fields.
Yeah, I think that's a very like I love that type of perspective because it also I think allows you to assert those mental and emotional boundaries with you and like what you're capable of and what the workspace is capable of, and that it isn't, like I agree with you. I don't think it's something that we'll ever see in our lifetime, but it is something that we can also help contribute to reduce and spread awareness about. So moving on, so would you like to talk about your advocacy with Fair Agenda and the project you're helping out with there?
I would love to. So with Fair Agenda, I'm running a campaign with them, and my campaign manager is Daisy. She does all the hard work. I just get to put my face on it and advocate as well and share it around. But oh, I just lost you. Hold on. I restart. I don't know what's happening. You're back. I'll restart. My phone just rang and it's connected to my computer. I don't even know how it did that.
Oh, that's okay.
Hold on, I put it on DND. I thought I already did that. There we go. Sorry. I've restart.
It's okay. You're fine.
Okay, where do I go from? I'd love to, that part. I'll just start
Yeah.
from there. All right, I'd love to talk about it. So, with Fair Agenda at the moment, I am assisting in running a campaign in regards to access to forensic medical exams. Daisy is the campaign manager. She does all the groundwork, reads all of the reports and summarizes them and sends me talking points. I have the easy end of the deal. But in saying that, the reason I am advocating with them is because when I was sexually assaulted in Richmond in 2021, I attended a rural hospital. It was the Hughenden Hospital. And I was waiting there. And once we pieced together kind of what had just happened, it was 2.5 days before I had access to a forensic medical exam because there was no one qualified to do it in the Hughenden Hospital. The male doctor, who was the only doctor available, as the female doctor was on leave, on holiday somewhere. So it was only a man, and he wasn't qualified. And he told me, someone can talk me through it over the phone. I'm like, get me a plane. I'm getting out of here. Like I was not doing that. Given the circumstances, I've just been raped, and then a man's like, let me do your rape kit. And I was like, not gonna happen. Like, no, thank you. So I came to Townsville, and even then it was again a bit of a wait from getting flown to Townsville Hospital, getting from the plane into the hospital, into a room. And then I had police that wanted to talk to me, a social worker that wanted to talk to me, and this really long wait period before I could actually get up there and do this forensic medical exam. So for me, that in realistically what they, had told me is you're not meant to shower. Ideally, don't use the bathroom. There's lots of rules around forensic medical exams. Unfortunately, I had already done all of that anyways before I kind of realized what had happened. But in the case that I didn't shower, it would have been 2.5 days before I could. So that is why I'm advocating with them on that campaign. And also, there's, it is really important, I think, to acknowledge that this doesn't just happen regionally and rurally. This happens in major cities. There was a woman who, in a major city, I believe it was Melbourne, someone might have to fact check me on that, but a major city nonetheless, who waited 30 hours for a forensic medical exam. And then the part that I think is the most hard hitting is this isn't just adults that are waiting, children are waiting too. In the audit that they did, on access to forensic medical exams, there were 4 children who also had to wait an unthinkable amount of time to access this forensic medical exam. It's wrong. We need people who are qualified to do this, ready to go at all times. There's ratios for so many other things. I don't know why there's not ratios for having someone who is qualified to do a forensic medical exam on shift at all times.
Yeah. So, I mean, thank you so much for, I guess, sharing that with me. I know that that would have been a very difficult experience for you, and I understand that, it's very difficult for you to have to express that emotionally, but you're right that, these type of cases need to be, need to have more of a quicker process when it comes to these types of exams. And and you're right, like 3 days is just simply too long, to I guess mentally like deal with that type of evidence for such a long period of time, and also just for like hygiene reasons too. It's pretty gross. I'll be
Yeah.
honest.
Yeah, it is. Like, you already feel dirty.
Yeah.
And then you have to sit in that for days. That's not that's not okay. I don't need to tell anyone that. We know that's wrong. It's an accountability problem. And I think, like, then we get into this like conversation about like the healthcare system being overloaded because we know that sexual violence is happening. It's an epidemic. It's happening at unprecedented rates. Whether people talk about it or not doesn't mean it's not happening.
Mm.
And so then if let's pretend we live in a fantasy world where every single woman or victim survivor, not just women, sorry, went to the hospital to report that, to get a forensic medical exam after reporting their rape. It would only be victims of sexual assault receiving that care in the whole 10-minute scheme.
Mm.
It would be endless. And we don't have the capacity within Queensland Health or any other health system in our state. We're not ready for that. But we are encouraging people to report. We're encouraging people to go and get the forensic medical exams. But we're not backing it up with people who are ready to do it. And I think like a way off of Queensland Health and like the actual hospital system would be, to have specialized services that offer that forensic medical exam, small health hubs, like at the sexual health clinics, for example, to take someone there to do it if it was within those hours. I mean, unfortunately, it's not going to happen from 9 to 5 every single time. It's just not how it works. But, if we can start taking some victim survivors elsewhere where it is accessible and quicker than having to wait 2.5 days in a hospital bed.
Yeah, and also I was also doing some other research about the rape kits. I know I know that currently in Sydney, I'm pretty sure it might be for Queensland too. There's also a decision about whether to change the name of, a rape kit because it is a very kind of very graphic name, but also about whether rape kits should be provided more. I guess there should be more accessibility to it for regional areas, like, providing it in like women's centers or shelters and that as well. What do you think what's your opinion about that?
I think like obviously accessibility is a big problem, but we need people who are qualified
Mm,
doing those. I don't think it should be a self-collect exam or anything like that. Mainly because rape kit is the biggest part of any rape investigation. Because if you very rarely, and I mean, I personally haven't seen a case where if you have no DNA, you have no case most of the
mm.
time. Unfortunately, like as harsh as that sounds, it's just the way it is. And if we're not getting those forensic medical exams done properly by a qualified practitioner, then that's just a whole lot more victims who aren't going to see justice.
Yeah, you're right. And I completely agree with with this idea, like with it needing to be done by a medical practitioner. Because I guess, not to be graphic, I'm going to try and be nice here, but I guess, for them to be able to assess the damage that has occurred is going to be able to further strengthen your case and hopefully, be prosecuted more quickly, right?
Yeah. And to withhold all the gory details, there is no way in my rape kit that I would have been able to physically see what they could see.
Mm,
So it needs to one be done by another person, to someone that's qualified and can testify in court. Because it would be very easy to throw out a self-collect rape kit in court.
mm,
So I think it could be done at other places, like I said, at a sexual health clinic. Like if there was a procedure room at a women's center,
mm.
sure, great. But what we need are more qualified staff, and we need them more accessible and available. And we know that the hospital system is overloaded, but this is such a major problem that people are going without access to these forensic medical exams and are leaving the hospital because they didn't get to have the exam done, and they're sitting up there waiting directly after a major assault has occurred, and they're walking out, and then people aren't being charged or convicted of rape.
Yeah, exactly. And I think that also further brings into the issue of the processing time of the rape kit and DNA. So I was reading a case a couple of weeks ago about this woman who was assaulted in Sydney, like in public. So, so she didn't know her perpetrator. And the rape kit took about 3 years to be identified for the DNA to process. And by that time, then the DNA, they said, was practically considered like not usable for identifying someone. And so, therefore, that case got thrown out the window. And apparently, like, that's also a really big thing as well with the rape kits, that the turnaround time for DNA processing to identify the perpetrator through that evidence is just like non-quantifiable because the time to process it is just not quick enough. Do you think that's a big issue as well?
Yeah, obviously. I mean, I don't know everything there is to know about forensic medical exams, but if like I believe that what you're saying would be true, I'm not surprised by that at all. But again, that comes down to funding and staff.
Mm,
You need to have more staff running these exams. You like the government has focused so heavily on educating people and encouraging people to report and has not thought about everything else that comes through.
Yeah. So as an advocate yourself, apart from, I guess, having like own medical services and stuff, what steps do you think the government could take? And obviously, having a female medical exam processor, like what steps do you think the government or the hospitals and that could take for it to be the most, I guess, least traumatizing, triggering experience as possible, within reason, of course.
Yeah, I mean, I don't think we're going to take away from it being a traumatizing and triggering experience, because the rape kit itself is another it's very invasive.
It's extremely invasive, yeah.
Um, and for me personally, like at times I was like, is this worth it? Because I feel horrible. Like I stopped the exam multiple times. I didn't want to keep going. Queensland Health somehow convinced me to keep going, even though I kept saying I didn't want to. Like it was super, super invasive. So I think the actual procedure itself will continue to be a very traumatic procedure. We're never going to get rid of that. Unfortunately, it's just a part of the process. But in the realms of like having quicker access to forensic medical exams to reduce the extra trauma, I think the way that the local paper headlined it was, I was raped and then abused by the system. And I feel like that's probably a pretty good, way to put it in a soundbite, I suppose, of like little clip of how it happens. But we have got some recommendations, which I'll try to summarize about the forensic medical exams. So we've got implementing statewide forensic medical exam services and ensuring that their suitably trained examiners are able to provide timely examinations. Permanent positions for qualified forensic clinicians, professional supervision and support to doctors and nurses performing those examinations. Ensuring that there are appropriate number of qualified forensic medical examiners to meet local needs in rural, regional, and remote communities, including the hospitals in Aboriginal and Torres Strait Islander areas, because it is really important that we don't forget about these communities, because the media like to forget them. But as advocates and specialists in this space, we have to do everything we can to remind everyone of how important and vulnerable those communities are. So the third one would be improve the availability of and access to pediatric services for child victims. I think anyone waiting is pretty heinous, but making a child wait is unacceptable in every account. Monitor the overall demand for forensic medical examinations across the state and implement effective strategies to address any gaps in services. So just those continual audits, I think, will be really important in making sure that we are addressing this as necessary. And lastly, continue to deliver training to doctors and nurses, again, in regional, rural, and remote areas, as well as the major cities, and how to deliver forensic medical examinations. And then, like, they are the main things that Daisy has put together, she's very good at a job. They're amazing. I think in the case of having people actively available, I think in regional and remote hospitals, every nurse needs to be trained in how to do a forensic medical exam. If we're not going to talk about ratios and, all those nitty gritties, every staff needs to be trained.
Yeah. Yeah, exactly. And I think you're right. And I think, and I think like it's really difficult because like coming from hearing this perspective, like you think that all of those points are quite mandatory. And I guess they're also practically essential, but also but also it's just really difficult because you know that it's going to take a long time for those to be brought in when they should already be essential as it is now, because it doesn't sound incredibly difficult to mandate those processes, but you and I both know that it's going to take a long time for that to happen.
Yeah, I don't understand why it can't happen tomorrow. Like, I
Mm,
mean, logistically, I do.
mm,
Logistically, I do, but
mm,
in my victim survivor brain, and just being human, why isn't it mandatory that every nurse in a regional town knows how to do a forensic medical exam?
mm,
Why isn't it mandatory that there's constantly enough people to do a forensic medical exam? Because rape doesn't happen at a convenient time for a hospital. That's
mm,
just silly to think like that. We need to have people constantly available to do a forensic medical exam, regardless of, if there's a major trauma coming in.
Mm.
Cool. Have enough doctors to deal with that. Also have enough doctors or nurses to do the forensic medical exam. Like, I think it's pretty self-explanatory. Again, not a knowledge problem, accountability problem, and it's just going to be such a long road forward. And I think everyone I've spoken to about forensic medical exams was like, "Oh, that's like the simplistic fix." I'm like, "Yeah, it's pretty straightforward."
Yeah, it is, and it is a like, you're right, it is straightforward, but I think also, like, this question might also be straightforward, but just, I think, to help, our listeners really understand why this is so important, how do you think that all these new, I guess, changes to help these medical kits, become more accessible are going to help the victims and also the support workers?
In and out of hospital would be great. I think that there is not a single victim survivor that wants to sit at a hospital and wait for that exam, and it really adds more trauma to the already traumatic story. Unless I was to sit here and I suppose lay it out in gruesome detail of a woman being raped, deciding to report or go up to the hospital for a forensic medical exam, and then waiting for hours in the same
Mm,
clothes she was raped in, and not having washed her body, still potentially having secretions on or in her. Like, it's disgusting that anyone has to wait, and then consider that to be a child. That should, be enough of a reason to understand why this is important.
mm,
It is too traumatic for anyone to have to wait for a forensic medical exam, and I don't think I can make that any clearer.
mm. Yeah, you're right. No, it is traumatic. I just wanted to ask that question because I think for, like, a lot of people, they're just not really gonna understand unless you're right,
Yeah.
like you've mentioned, they're in that moment themselves. But
Yeah,
you're right, like,
absolutely.
just the processing of it itself and, like, just being in that moment, you're right, like, it is extremely traumatizing. And then also, I think also there was, part of the third agenda that I was looking at that also mentioned that there should be, I guess, some form of aftercare or some type of counseling or mental health care after that experience as well. What do you think
Yeah.
about that?
Absolutely. SARTs was a lifesaver for me. I honestly don't know where I'd be without the sexual assault response team. And that person that came up, she was my ongoing counselor afterwards. I'm not going to call myself lucky, but I was in a position at that time where wait lists weren't as shockingly long as what they were
Mm,
now, as what they are now, sorry.
mm,
So I was able to quickly link in with counseling after that had happened. I had the social worker meet me at the hospital. She actually spoke to me on the phone while I was still in Hewenden. Um, it would be great to think that there's social workers available at all times to go up. But again, that's another problem
mm.
within this problem. But I was able to have access to someone to speak to when I was in Hewenden, and then she met me at the hospital. So it honestly made that whole situation easier because, I mean, I had my mum at the Townsville Hospital, but she was just as freaked out as I was. Her kid
Mm,
just got raped, and I mean, I was an adult, but I'm still her child, and
mm.
so she was just panicking, and I had this calm, cool, collected person who was just there for me to talk to me and talk it out and link in for support. So I think it's clear that anyone needs support after a violent assault.
Yeah, and so what is the sexual assault response team? Are you able to go into a little bit more detail about that?
Yeah, I don't have all the specifics about them. I don't want to get it wrong, but it's through the Women's Centre in Townsville as the sexual assault response team. Um, and they are trained workers. You have to be trained, from what I know, you have to be trained specifically to work within the sexual assault response team within the Women's Centre. So it's a bit of a double barrel, but they're all the same team. And so it's a 24-hour on-call system. So one worker will have that phone for 24 hours, and any call out for a rape at the hospital, they'll go up. And then sometimes that's reporting to police. They'll go and sit with you while you talk to the police. So it's just that holistic wraparound of making sure survivors always have support if they want it. Because that's also important. Some people don't. Some people just want to be like, leave me alone. Don't talk to me.
Mm.
There is those people as well. So I think it's really important that it's not pushed on you. It's optional. The support's there if you want it. But it is a 24-hour wraparound support for those crisis needs.
Yeah, I was just asking that because I'm
Yeah.
pretty sure, and I'm hoping that that probably is transferable to all the states and territories. I'm pretty sure that that
Yeah.
type of
I
service is available in every state. I hope.
I think it happened. Honestly, I couldn't tell you for fact, but I'm pretty sure there is some regular services across at least Queensland that do this. And then within like rape crisis centers as well, they have their own programs. So I do believe it happens in other places, but again, even I'm not too sure of how many places have it because people don't talk about sexual violence enough.
Yeah, yeah, exactly, and that's why we're both here, and that's why I wanted to invite you on here so we
Yeah.
can so we can have these conversations and start talking
Yeah.
about this. So I think like my final question for you to finish off this podcast is, like, do you have any, I guess, words of wisdom or compassion for people who are listening to this who might be going through like a bad situation right now?
Yeah. So I believe you. That's the first thing that I want you to know because a lot of people don't get to hear that. And if for whatever stage of your journey you're on, if you're still going through it, I want you to know that the light is there. You can leave when you're ready. The support is there. I know we've just talked about wait lists and accessibility issues, but I don't want that to deter you from reaching out to support, contacting places like DV Connect, 1-800 Respect, who can link you in with those relevant supports, or your local service. They triage, they can help you in that moment. Just because we talk about wait lists doesn't mean that they can't help you. And I think it's really important to acknowledge that because a lot of the time I think it's a bit of a scare factor when I talk about that there's no accessibility. So remember that there is help out there is one major thing. And if you have just reported, this journey ahead may seem super long, but lean on the people around you. And if you're towards the end of that, maybe reporting, or you've gone through court, or you're just trying to heal now, maybe you just decided you didn't want to report and you're healing, lean on other victim survivors. They're going to be your biggest support network. You can't forget or drown out what happened. Um, it doesn't have to become who you are. You don't have to be an advocate. But unfortunately, it's something that happened, and there are only, other people around you who have experienced it are going to be the people who understand how you feel and you can talk to without judgment and talk to freely. I'm so lucky with my crew that I have. Like, I have my friend Yuki, my friend Sam, who I just lean on constantly for that support because they get it. I don't have to explain it. They get it. So lean on your people and reach out for support if you need it.
Awesome. That's a beautiful way to end the podcast. So thank you so much, Evie. Thanks for your time.
Oh, thank you.